exposed to that sort of testing.
Yes.
Whether it matters is another issue. I mean, I think the whole business of specific language impairment being defined that way came in because it was useful for researchers. Because if we are saying here's something that is a feature of specific language impairment, it's much easier to be clear that that's what it is if the child has only got a problem with language. But the reality is that the boundary between specific and non-specific is not clear. As far as we can see, the causal factors are not that distinct. And in addition, the prognosis, as we heard today, doesn't necessarily make any difference. So on the one hand, it's irritating if you, I mean, it might be a useful piece of information to have, and it's irritating if you've got ed psychs who are not going to do any assessment. But on the other hand, I think we may be too fixated on it, and it's a real problem then, what on earth we say we're talking about though, because I'm very, very concerned about labels and the impact of labels, and it's come out from what Julie's saying, that the label you get has a huge impact on the intervention that you get. And I've done some, I gave a talk in the British Psychological Society a couple of months ago, contrasting the impact of a label like dyslexia with a label like SLI. Nobody's heard of SLI. Nobody knows what it is. That's why we've got a campaign to try and sort of get people more aware of it. Dyslexia, everybody's heard of it, but people have completely false ideas about what it is. They think it's a neurological condition of a well-defined kind, and that it gives you superior skills and things. Absolute rubbish. So, you know, we have these two, they're really just demarcating different areas in a huge space where children can have all sorts of permutations and combinations of problems. And my concern is that we're not really dealing with these discrete little disorders at all. We've just got kids who have different types of problems. But the ones who have principal problems in the area of oral language are completely neglected because they don't have a nice label that everybody recognises that gets them straight onto appropriate intervention. What you do about it, I think, is extremely hard. But I mean, there's two things about it. Where you put the cut-off, how specific should it be? But also, what about all these other things that often go along with language problems? Attentional problems, motor problems, literacy problems. You know, these are not neat little boxes that children sit in. But my view at the moment, and I've moved quite a long way, is that for sort of, you know, deciding who gets what intervention, I'm not convinced that non-verbal IQ is all that critical.
Julie, do you want to add anything? You don't feel like you have
well, I would absolutely agree with everything Dorothy said, and certainly the evidence that we collected this time around and previously was that wasn't the predictor. We needed to look at the individual child in more detail. But the other thing, I'm not a speech language therapist, so I can say this, about the notion about diagnosis. At the beginning of the Wechsler intelligence scales, Wechsler writes something about what this test is for. And he says it's the sort of the aperitif, or the starter of the meal. And the question is, what next? And I actually think for the profession, the question is, however you profile the children's needs or describe them, the question is, what next? And where is the evidence that it's actually effective? It's true for education in terms of what they do in the first phase. So that would be my issue.
Okay, can I just make a point? I feel the need to defend kids with ASD getting all this support. I think there's an inference being made that their language skills are better, and yet they get so much more support than children who have low language skills. But that's not why they're being supported in school. There is perhaps an unfair discrepancy, but it's because the ASD kids are failing to access the curriculum for a lot of reasons. And sorry, let me just wait.
But our data,
But very often the kids who are getting the help are also kicking off. So they're the children, that's just want to come to that. They are failing to access the curriculum, not necessarily more than the SLI children, but they need management. And I can tell you honestly, having seen hundreds and hundreds of children in all sorts of schools, if they're not kicking off, they're not getting support. So it's not actually...
I think it's really subtle, because if you observe their behaviour, and on standardised measures of behaviour, there are slight differences in the profile, but they're subtle. But one of the things that, and I think Jessie would confirm this, she was in the classrooms, that actually depends what support means here.
True,
because
that's true
if support is stopping you, in the sense kicking off in the classroom, is that what...
Oh no, I don't think it's adequate. I don't think it's in any way what we want. but that resource allocation is actually, people see a child with ASD and they think, oh my goodness, this person's going to be trouble.
But as you say, it's not necessarily a child with ASD or not ASD, it's a child with a label of ASD.
Yes.
And the most telling thing to me was I was talking at an aphasic meeting a year or so ago, and I'm very exercised about this issue of labels, and I thought it would be interesting to ask parents, what sort of label do you think would be a sensible label? It didn't work at all, because this parent said, well, my child's got a language problem, but I would love them to have a label of ASD, because then they get more support.
Diagnosis shopping.
Yeah. So,
Could I just ask the lady in the purple, she put her hand up next.
I'm Rachel Mother, I'm a speech and language therapist in Catherine School, and I work with 16 to 19 year olds, and they've got language disorder or they've got autism with language difficulties as well. And it was just to say really that both of those impairments are lifelong, and the support that they get can be very different. When they leave us at 19, if they've got a diagnosis of autism, they have much easier access to social workers, to personal budgets, to all sorts of other things. If they have a diagnosis of language impairment, they don't, because that doesn't seem to be recognised by speech language adult services, because their cognitive level is above IQ of 70, they don't meet the adult learning disability scheme. So just for kind of like independence and for lifelong learning, we can teach them strategies as much as we can to support them with their ASD and with their language impairments. But often they do need that little bit of support afterwards as well. And just to say, recently our young people at the FE Centre have done a campaign with some funding through the Olympics, and what came up in that was that independence was really important to them, and that they really felt that they needed specialist support to improve their independent skills, and that they don't want to be not being able to access colleges or access jobs, and that actually their aim in life is to live as independently as possible and to get jobs and to access college courses. So I just think that's kind of like their voice saying that we want support to be able to do this, and if we look at it from a money point of view, in the long term that's better for the taxpayer as well, because then they're living as independently as possible and not.
This really came out in the study that Vicky mentioned of diagnostic substitution. This was children who I had originally seen in the 1980s, and we followed them up into adulthood. And this point came across really clearly when we followed them up. So we did do these assessments to see, would they meet contemporary criteria for autism, which of course had broadened hugely over that time span. But we also talked to them about, what they felt about life as an adult with a language impairment. And it was exactly the same thing, that there was one young man who said that he was very pleased because he'd now got a diagnosis of Asperger's syndrome. And that meant that a factory would take him on because they get bonus points for having a disabled person. And this is not the case if you just say, I've got a language impairment. So we really, I think, the profession of speech and language therapy, the profession that deals with these people, has really got to get this somehow changed, because it's a great, dyslexia gets recognised, autism gets recognised, language impairment in adults does not, and it's really seriously a problem. But one of the difficulties we have is that then people say, well, what exactly is it? And none of us can agree.
And I think we've also got to stop pretending that we can resolve it.
Yes. And I mean, that's my other big mission in life, is to say that as well as, obviously one is going to try and help children with the problems they've got, but I think we should also be putting a lot more effort into saying there are some kids who are not likely to be resolved, and we should be looking very hard at what things they're good at and can do, which might give them a route into a life in work, and spend time in the curriculum doing those sorts of things.
We've got 2 more questions, and then I think we'll have to finish, I'm afraid. But we would say that we'd like to keep this discussion going online, so if people can get into our website in the next couple of weeks, hopefully, thanks from support from Courtney, we'll be able to.
I think there will
be a way
to leave comments.
To continue the discussion. The gentleman, I feel like Jonathan Timble did. The gentleman at the back with the glasses and the beard.
John Harris, I'm representing in that debate. It's really just a bigger question around the DSM. How important is it that we exercise ourselves about how the DSM categorises it? Is it more important to be worried about what the DFE is saying when they recognise SLI and whether they recognise language disorder or language impairment? How does that fit in sort of the reality of what we have to do here?
Well, I kind of think that both are important. It's true that people don't use DSM criteria very often in research. However, I think
it's hugely important in America because it determines whether you get insurance payments for treatment. And this has been a big debate on the issue of, for example, auditory processing disorder, which is not in DSM. And so people who think their child's got an auditory processing disorder get very upset because their insurance company won't cover it. So it has that implication there. Here it doesn't. And as Courtney says, I mean, I did an analysis of the terminology that people use in this area. And in fact, people were not using terminology that had been proposed by DSM, not even in the States. It has a bit of an issue in that if you're a researcher, it can be a bit of a nightmare getting something published unless you can say these children met DSM or ICD-10, which is the WHO equivalent criteria.
Can I follow up with the lady with the glasses at the second last?
I was going to ask a very, very similar question. I was simply going to ask what the panel's reaction was to the proposed DSM classification. Because it seems to me that if we can specify what these different levels mean and what these different levels mean in a secondary breakdown, we may actually be within sight of having a code which can be agreed or disagreed when we come to education tribunals.
Yeah. Well, that's exactly what I was going to say. I think, although at the moment people don't use that terminology, in a situation where you're trying to limit your spending on resources, people can use it, right? Mm-hmm. And this is one of the things that sparked it off. We were saying, we get these comments that this child isn't language impaired, or this child shouldn't be at this school, or you shouldn't publish this paper. And there is nothing to go back to say, well, this is the agreed consensus criteria for language disorder. So I think it could be very powerful in that respect if we get it right. And also, it's just raising our professional profile. Why aren't there speech and language therapists on the panel? It just drives me crazy. It just makes it, basically we're letting other people make decisions about the kids that we spend most of our time seeing, and I don't think we should let that happen, really.
Well, I think we're very fortunate in that we've got we've sort of persuaded the panel, at least some of you, to stay after lunch, and some other people as well, to begin to put a response together for this during this time when we can be consulted on this. So I think that's brilliant and really, really important. Becky?
Just to say, I think we've perhaps the three areas, the themes that were brought up, and diagnosis and genetics, perhaps isn't the way to go. The differential diagnosis, obviously there's a lot of issues there. I think we as clinicians, wondering whether the research side can help us with the response to intervention side of things, because it seems to me that that's essential and really important. Diagnosis doesn't necessarily tell us what that child needs, and obviously there's a lot of challenges with trying to measure response to intervention if you've got a short assessment with a child. And really, I think there's a lot of help we need from you.
Well, I think mostly we're happy to give that help, but one thing I would say is think carefully about what the outcome measures are, and that's why I said thinking about this functional impairment, because I think we all know we can't cure it, but if you look at the RCTs, that's what they're trying to do. If the outcome measure is the KELF, you don't show that the child improves on the KELF, no one cares whether the child improves on the KELF, we're kind of shooting ourselves in the foot. Yeah. So we need to have a better way of measuring change and measuring impact of change.
I think at Moor House we're sort of, is this intervention right for this child or is it not? Whereas somebody perhaps making a decision which intervention doesn't necessarily need to know how much progress will be made, but which is the right intervention, which one is going to work best for this child.
I think we're going to have to leave it there, folks. It's just gone 12:30.